Kaieteur Radio.
Good afternoon, everyone. Welcome to another edition of Your Health Matters here on Kaieteur Radio. I'm your hostess, Rihanna Ramsey, and I trust that everyone is well today. We have a program for you where we will be talking about discussing actually the COVID-19, the Omicron variant. This is a part 2 of our discussion, and we have joining us also virtually is Dr. Shivani Samlal, a gynecologist, oncologist, and she's also a women's health specialist. We were supposed to have Dr. Ramsamy with us today, but I must apologize on his behalf. He has quite a busy schedule, and he wasn't planning on another engagement coming up at the same timeline. So I must apologize on his behalf. Dr. Samlal, are you there?
Yes, I am.
Hi.
Can you hear me?
Yes, I'm hearing you. I'm seeing you as well. So
Okay.
for those who are regular viewers and listeners to our program, they will know that you were one of our main contributors by now, because you usually are one of the persons who come on here with me to discuss the various health topics. So we are talking about COVID-19 today. You were here the last time with Dr. Adakro, and who is the former PAHO representative to Guyana's representative. And we discussed quite a lot before. And so this is basically a follow-up because of what's happening now. Because when we talked about it before, that was when we suspected that it might have been in Guyana. And that's like coming up to the Christmas holiday, but now we're past the Christmas holiday. We were warning people back then not to, get too carried away with the festivities and forget the guidelines. And now we're seeing a spike, a dangerous spike, 900 and something cases, 954 cases or something like that. I can't remember offhand on Monday alone. Could you touch on basically why you think this is happening now? Because we know people were careless. We can't look past what was happening during Christmas season, the rush to get everything and all the crowds in Georgetown and the parties and what's not. So just touch on that a bit, and then we'll probably talk about other stuff. Some of the other
Well,
stuff.
I think we predicted that that with the Christmas holidays coming on, that Omicron, which is a new variant, would have hit Guyana. And we spoke about the fact that, US at that point in time, especially New York, we were seeing the rising in number of cases in New York. And we know a lot of us Guyanese have families that were coming in for the holidays from New York. So I don't doubt that was how Omicron came to Guyana, and because of our carelessness over the holidays. And, that was responsible for the surge in cases. And we could tell that, I think, in a week or a couple of days, we were over 1,000 cases shortly after the holidays. That's early January, I think. And it's basically what you said, present for out and about partying, no mask, in the market shopping, and, basically getting, what do you say, lackadaisical. They weren't
Letting their
really
guard
taking it.
down.
Yeah, they were definitely letting their guard down. So that's basically what happened over the holidays.
Yeah, so one of the things when it comes to this variant, we see a lot of more persons being, because they said this variant is more contagious, so more persons are being infected with the virus. What do people have to worry about most in terms of like symptoms, and how do they take care of themselves? So just touch on that a bit for me.
So, what with this variant, what we're seeing is that the symptoms are basically very flu-like, and so patients are not referring the typical loss of smell that was happening with the Delta and the initial SARS-CoV-2. So you're finding a lot of more flu-like symptoms, and persons were saying, "Oh, I have the flu," and they're not even thinking that this might have been COVID because they weren't having the typical loss of smell that was typical. So the symptoms are very for most persons they're more mild, but that doesn't mean that person who doesn't have comorbidities or other underlying illnesses, they can get severely ill. So the symptoms are generally fever, nasal congestion, probably some sore throats, body aches. Most of them are treatable with over-the-counter drugs. But the most important thing is that, you need to basically protect yourself during this period of time.
Mm-hmm. And in terms of, I mean, we have flu and other viruses that have similar symptoms. So how do you recommend, because testing, there are a lot of persons who are running for tests now because they're saying, oh, this thing is widespread. So would you recommend, as soon as you see a symptom or two, do you recommend getting tested?
No, well, I mean, there's this infectious period initially.
Mm-hmm.
So it's as soon as I think is the recommendations to day 2 and so forth from the initiation of symptoms, that persons day 2, 3 of initiation of symptoms is when persons should get tested for the virus.
Mm-hmm.
Not
So
initially, yeah.
So within 2 to 3 days, like if you cut your symptoms,
yes.
So you have to because I don't know what's our capacity, and I was hoping Dr. Ramsam would be here to talk about that.
Yeah, I don't know that either. So he's the best person to,
in terms of the testing, our testing capacity, because we have Georgetown a number of testing sites, but with the number of tests being done now, I don't know if we have the capacity to do a lot more, because people are not just testing just because they see symptoms. Some people have to go do tests if they have to travel, if they have if they were exposed. So it's not just symptoms alone. So it would. Mm-hmm.
I think what's important there to say too is that that's for persons who have symptoms, but for persons who suspected exposure of the virus. So say you were in contact with somebody who have the virus, so post exposure without symptoms, I think the testing should be on day 5. That is the international, that's at least CDC's recommendation. So it will vary on if you're symptomatic or if you suspect that you might have it based on the fact that you were exposed to someone who had the virus.
Mm-hmm. And in terms of what we have been doing, as we spoke about before, we talked about the fact that we, as Guyanese, we get carried away with the festivities, and then we let our guard down. Sometimes just not consciously, but subconsciously, just hurry in to get things done, and you might have exposed yourself. You might have exposed yourself to someone or in some scenario. What do you think that we can do? Because I had asked you off before. What do you think that people are doing wrong right now? Because the holidays are gone and we're back to like work time and school time. What do you think we're doing wrong in terms of not?
So I will answer that on a more broader spectrum, because I mean, it's a general thing. It's not just Guyanese. What you're finding is the inequitable distribution of vaccines to begin with. Now, every country has a target, and I think WHO's target for at least 40% of countries, or the majority of countries, to reach a 40% target of being vaccinated. Now, in Africa, for example, over 85% of their population is still yet to be vaccinated or to receive one dose of vaccine of their vaccines. And you'll find more in lower resource countries, for example, that the majority of persons are still yet to be vaccinated. Now, why I'm quoting all of these stats and why is this a problem is because we know that if we're not vaccinated, that what this is doing, it is creating an open door for more variants to emerge. And that is a problem. And it's not just on a personal basis. This is more of international and the rich countries just buying up all the vaccines, trying to protect their population. But ultimately, they won't do that because new variants is going to emerge in those unpopulated, unvaccinated populations, and then we're going to be back to square one, as we're seeing with this new variant that is here. The other thing to think about here is still the vaccine hesitancy that exists. So that's something that even we here in Guyana is doing wrong. You'll find that even the rich countries, they're still to reach the target, even though they do have the vaccines. In Guyana, we are not the rich country as yet. Hopefully we'll get there someday. But we're still to, have the majority of our population is still to be vaccinated. So that is something that we are doing wrong also. And the others, we're letting our guards down, as we said earlier. We're not taking the necessary preventative measures as we should. And what we do know about this variant right now, the Omicron, is it's far more contagious than the Delta. I think the Delta was one person was capable of infecting 9 persons. But what you're seeing is if there's a crowded room, that one person in that crowded room is can potentially infect the entire room. And that's something that I think that we're yet to grasp how contagious this variant is. And once we understand that, I think we need to use that as a scope to always have on our mask and try to avoid, crowded spaces and be in ventilated spaces and so forth.
Practice
so those are
the
things
regular,
as
the regular stuff that we wash your hands and sanitize.
precisely.
In terms of the vaccine, because you were saying the vaccine, we need to, our population still has quite a way to go in terms of getting vaccinated, and some people we're still dealing with, to some degree, with vaccine hesitancy. But in terms of the effectiveness of the vaccine and this variant, I'm told that this variant specifically attacks some of the components that the vaccine brings to build up your immune system. So tell us about the effectiveness of this vaccine, the vaccine with this variant.
So what the data is showing is that there's still a high in comparison to the other variants. Mm-hmm. There's a lot of breakthrough infections. So even though you're vaccinated, you still are at risk of exposing other persons to the virus. Vaccines are supposed to decrease that risk. So there's still that. I completely forgot what I was saying, honestly.
Yeah, it's the vaccines we're talking about, but
yes,
in terms
and
of
effectiveness, yes, and then what we're seeing is that they potentially reduce your risk, even with this variant of even though the risk of breakthrough infections are high, they still potentially prevent you from getting severely ill and of dying from the COVID-19. So ultimately, with this variant, the vaccine still prevent you from getting severely ill and of dying from COVID-19. So you should be vaccinated. And that's why they're also recommending the booster dose. I'm not sure if that's what you were going to get at.
Yes,
Because
that's my next question. But
yeah,
people would want to know, okay, so I'm fully vaccinated. I got dose 1 and dose 2. Why do I need a
mhm.
booster shot? And is this going to be something that every 6 months are we going to like, I mean, from a medical perspective, from your personal, I don't know, medical perspective, you do you see this going in the same direction of having to get a flu shot every season?
I think it might be. I think even the persons the Pfizer company, the CEO was actually suggesting that that's the feasible thing is not having regular booster doses, or at least it should be a yearly thing. So that is the long-term feasibility in terms of the vaccines. What we do need to understand though is that with new variants, these vaccines weren't intended for mutations. They were intended for the original SARS-CoV dose, and because variants, these new variants are mutations. The vaccines are not as effective as it was against the other variants, and this can potentially change if new variants appear also. So that's something that we need to take at the back of our mind. But essentially, the main thing that people should take away from this is that even though the effectiveness is not as how it was with other variants, these vaccines still prevent you from not just the risk of transmission, but also of getting severely ill and of dying. I think that's what people need to take away from this.
What about we spoke about in terms of COVID-19, we talk about persons with comorbidities, older persons, and so on. In terms of children, because given that this is something that's becoming widespread, and I know you have a spot for children, given that you're a gynecologist, you deal a lot with pregnant women and so on, and being a mom too. In terms of children, how do we protect them? How do we basically
Definitely.
safeguard them? How do you
I
recommend this
think
going forward?
what we need to understand in terms of children is that the vaccines have shown that they prevent children from getting severely ill and of dying also. What we know is that, when SARS-CoV was first, when the pandemic just started, that we weren't really concerned in terms of children getting severely ill from the virus. But with the new mutations happening, we've seen that, children really get sick and children die. I think since the pandemic started, I mean, the recent data that I had was that 15 children died. And for the new year.
That's locally.
Yes, that's in Guyana. And for the new year, we've already had 2 deaths, and we're not even the end of the first month. So that has shown a change from over a year period of only 13 deaths, and then all of a sudden the year started and we already had 2 children that died. So that's something to show, and that doesn't exclude the number.
So this is a new area of concern.
Of course it is, and the data is clear. The data is clear, and it is one of the reasons, besides getting the majority of the population vaccinated to prevent more mutations from happening, is that to protect kids from getting severely ill and dying. And we have to remember that not all kids or children are healthy. You have kids that are immunocompromised, have underlying medical illnesses, and so they can get very, very severely ill, just like adults. Children with cancer, leukemia, lymphoma, all those things. And so, to protect those kids, we need to ensure that they're vaccinated, because vaccines are offering that layer of protection that nothing else can. So we should ultimately do that, ensure that our kids wear their masks, keep them from crowds, and to practice the other basic, preventative measures.
In terms of pregnant women, because this is the area that this is your field, you're a gynecologist,
yes, sure.
oncologist. women who were pregnant or nursing and so on, how safe would you say, and how would you recommend them getting boosted, and how often would you recommend them going to take a shot to make sure that
they're
you know.
healthy and protected against the virus. Well, I think that there's so much data that is out there that's shown that vaccines prevent women from getting severely ill, also similar to kids. I can quote one such study that was done in Scotland, for example. I think there were over 85,000 persons that were enrolled in the study from December of 2020 to October of 2021. And in that study, that big study, what they found is that women can get severely ill, and children and their babies also. So they found that persons who were unvaccinated, that they had and were infected with COVID-19, that their baby was at risk of born premature, of dying, of being a stillbirth, or even die after delivery. And that is precisely if they get infected. About that risk increase if they get infected, like coming down to the latter part of their pregnancy. So they quoted about 28 days. And what they've seen is that persons, the majority of persons, I think 98% of the population that are the women that were hospitalized and needed ICU care were persons who were pregnant women who were not vaccinated. So we can see why vaccines are effective in terms of preventing women from being hospitalized and get severely ill from COVID-19. And we can see that once persons are vaccinated, pregnant women are vaccinated, that they ultimately protect their babies. They protect, there's that layer of protection from getting, from your baby dying inside of you, dying after birth, and also from born prematurely. So the recommendation is for them to get vaccinated. Pregnant woman is still considered as an at-risk population. So it's almost as if they have a comorbidity. Because when you're pregnant, as we would have said, your immune state is not the same, as a regular person, and then you're susceptible for a state of what you call hypercoagulability. And so those are things that put you at risk. And plus, you might have other underlying sickness. You might have diabetes, hypertension, other things. So ultimately, because they're a high-risk group, you're very susceptible if you should get COVID-19. So vaccines, protective masks, and also the booster dose. The booster dose will vary, though. It will vary in terms of the interval between the last dose, and it will vary for vaccines. So the general population, and pregnant women included, what is recommended is for most of the vaccines is for there to be a 5 months interval. With Sinopharm and Sinovac, they're recommending 3 to 6 months, but I think we in Ghana have adopted 5 months as part of our program, if I recall correctly. So the interval is saying that, about 5 months from your last dose. In the case of Johnson & Johnson, the interval is 2 months. So women need to know this. So if they are unvaccinated, that they should get vaccinated. And if they're vaccinated, fully vaccinated, that they are eligible to have and they should, not just they are eligible, but they should get their booster dose, because it's an additional layer of protection against the virus, or this variant at least.
But for those who aren't severely affected by the virus, let's say those who are asymptomatic, what are the recommendations for them? Because some persons might say, "Oh, I don't feel sick, I can go out in public." Some people, we call Guyanese parlance, they're hardy, so they're gonna go out. They want to stay isolated. How long should they be isolated so as to, protect themselves or protect others from spreading it? What is the recommendation here?
I think the recommendation is 5 days. If you're symptomatic or not symptomatic, you should quarantine for at least 5 days, and then after that 5 years period has completed, then you still need to wear your mask for an additional 5 days around persons close by, even your family members, because you're still at risk, of spreading the virus even at that point in time. So the general recommendation, to reiterate, is 5 days if you're symptomatic or asymptomatic, and even after that period of isolation. After that period is completed, you need to wear your mask at least 5 additional days.
I was reading somewhere that well, in addition to getting vaccinated, we should take our supplements and, eat healthy and what's not. And some of the things that we can use is some supplements, vitamin D and C and so on. However, my next question would relate to the emergence of new variants. I just read that just before the show started, the WHO Director General saying that the way we're behaving, we're at risk of new emergence of new variants. What would you say about that, and how does Guyana prepare in terms of that kind of thing?
I think it is, we should be concerned if there are emergence of new variants. That's something I fear, for example, and I fear that because, for example, Delta came, and we know how deadly Delta was. The number of persons who died from Delta was huge, and then this variant came, Omicron, and we found that how contagious this variant is. And so if we have another variant that is a combination of Delta and Omicron, which is contagious and deadly, and which our vaccines cannot target, or our vaccines doesn't offer protection against this variant, then what happens next? What is it going to be? It's not just that pandemic is going to prolong, it's just that a lot of people are going to die. And then in Guyana, we are not a first world country. The good thing is that we have the vaccines that is currently available, but we're not a first world country. We don't have the capability of people when they get severely ill and need ICU care. We don't have that capacity, and they keep expanding the COVID hospital. But to what degree, how far can we go to accommodate people that gets really sick and need these hospitals? So that's something we need to really think about, really. And as I said, I'm worried. And that's why the international recommendation is for persons to ultimately get vaccinated, because that's what the vaccines do. They prevent you from the virus, for them to change character, for the virus to change its characteristics. So, and also for new variants, they prevent new variants from emerging. So that's something we need to think about. And in Guyana, granted, Rihanna, we're not an old population like a lot of countries that had a lot of deaths, but what we do have is a lot of persons with comorbidities. And if we've looked at international statistics, I think they quoted that the majority, and that's something what people would use as a reason to not get vaccinated, is when statistics comes up, even in Guyana, and they said this person died and was fully vaccinated. They use that as their motive not to get vaccinated. But what data, and they need to understand, is what the data has shown is the majority of people that have in this with this new variant and so on, that were hospitalized, had comorbid conditions. And the majority of persons that died had more than 4 comorbid conditions. And I can remember when I read this new MMR study that was published that showed this. I can remember that the minister had said in one of his press conference that the majority of persons, or if not all the persons that died, had multiple underlying comorbidities or underlying medical conditions. So we have to take that at the back of our mind and keep that there, and understand that persons that die that are fully vaccinated, they have comorbidities that put them more at risk. But ultimately, the vaccines do protect the majority of the population from getting severely ill and dying, and even transmitting the virus from one person to another.
Okay, so so most of my other, thank you so much for all that you said just now about giving us, impressing on us the importance of vaccination. But most of my other questions would relate to policy and all that kind of thing. And that would have been Dr. Sami. Those who are tuning in today, we just want to encourage you to stay safe and get vaccinated. It will be a short show today because we have Dr. Samlal took time out of her busy schedule to be here with us. And I took some time off to just host my program. So just stay safe, make sure that you're vaccinated and use your supplements and so on, so that and stay, I always call it physically distant, socially distant, so that you don't put yourself at risk, because we're seeing quite a number of cases coming out, and these cases are not new cases, basically not within the 24 hours. I believe this would have been over the holiday season, and now that they're getting tested, you're seeing the results of it. So,
and then what we need to understand is that the more persons that are tested positive, the more likely that more persons, because if one person can transmit to 9 persons, the spread is more. So we shall expect that there are far more persons who will get positive, if not all, or get infected with COVID-19, if not all, at some point in time. But that just, will put more persons, more stress on the hospitals, more persons that will get severely ill.
And we have quite a number, you touched on something there. We have quite a number of medical persons who got, when this spike started, who got sick, and a number of them had to isolate themselves, which weakens our healthcare system. So
already weakened healthcare system.
We have persons getting sick, more persons getting sick, and then we have the healthcare workers getting sick. So who's going to take care of who? So you have to take all these things into consideration when you're out and about, you're shopping, whatever you're doing, your day-to-day activities. Please protect yourself. Please do the right thing. Wear your mask, use your sanitizer, wash your hands, stay socially distant. And probably next time we'll have Dr. Ramsamy and probably Dr. Samlal and some other persons to come talk to us more about what we're doing and to help us, to guide us through this pandemic, because we
can do better.
We're supposed to be. I was hoping we'd be out of it by now, because it impedes on so much. It's impeding on education. It's impeding on our ability to travel, because when you go to travel, you have to have all these extra checkpoints now. You would know that time interval. You have to complete that time interval also before you're able to travel. And it's difficult because sometimes it's clashing with so much. So for us to get back to some state of normalcy, we have to cooperate with the mandate, we have to cooperate with the guidelines, and we have to try our best to protect ourselves, stay safe, get vaccinated. We both, Dr. Samlal and I, are vaccinated. I think Dr. Samlal, you have your booster as well, right? I did my booster.
I haven't, because I'm still I'm entitled for my booster next month. So that's the beginning of next month. I'm gonna get my booster because
I had mine. So it's everybody just needs to just cooperate and try to see how best. I haven't had COVID, thank you, thank God. But
how do you know that? Have you tested?
Well, I've never tested. But the way it is going, you have to be so careful, because you don't know. Because some people probably could have it, and because of their immune system, it's not showing the symptoms, so they don't know they have it. So
And I think, Rihanna, if we have time, I think one of the things that most persons are questioning is that, oh, okay, I've had 2 doses of Sputnik, and I need to travel. And if I have if I take my booster, that is Pfizer, is that enough for me to travel to the US, for example? And I'm not sure if this is important to clarify here, but to enter in the US, you need to be fully vaccinated. So ultimately, if you take your first dose of Pfizer, then you will need to take a second dose of Pfizer in order for you to travel
Yeah,
to
so
the US.
all these bottlenecks came up because of COVID, and we're trying to get out of the pandemic. For those of us who are really trying to cooperate with the mandate and so on. So for those of you who are lagging behind and so on, if you really want us to go back to a state of normalcy, we have to do something. We have to cooperate to get there. So you know what we go through for those of us who travel and have this
For
have
sure,
our
and I'm sure the majority of us in Guyana we travel, and most persons travels several times a year, and and with new variants and so on, who knows if and the vaccines are not capable, if they're gonna be shut down again, and that's gonna I don't know what's gonna happen.
affect a lot of people, affect a
Yes,
lot of
that
plans. So
and
just
businesses and economy and children lives and
more than
everybody is
there's more than
severely.
health here.
Yeah, there's
So
more than health involved, and domestic violence and abuses and those things. So it's just far more beyond health when it comes to COVID-19, and there's a lot of other repercussions on all spheres of life, and I think that's something we need to keep at the back of our minds also.
mhm. All right, so we had a quite a short discussion because we're booked today, but we were glad to join you and try to give you some more information to stay safe. Make sure you take your vitamins, your vitamin C, your vitamin D, you get your shot and so on, and you stay socially distant.
Rihanna, regarding the vitamins, have you found any data to support the use? Because I was trying to
Yeah,
look into
vitamin
that.
C definitely. Vitamin C
Yeah.
definitely. And earlier in the in when COVID started, there was data to support vitamin D being
I
being
think
something
ultimately it comes down to having a good immune
immune
system, and
system.
I think your vitamins are going to help you in terms of having a good, capable immune system. So if a
Mhm.
case you get infected, at least you're a bit more immunized or capable to fight off if unless in comparison to if you're not fully capable or you're short of your vitamins, because you have people who are low in vitamins. For example, I can remember when I traveled, I did my vitamin D test and it was low. And I was like, hey, I live in Guyana and I'm exposed to sunlight. How come
Sunlight.
my vitamin D level? That was surprising to me. So, it is beneficial for persons to take their vitamins because ultimately you don't know if your vitamin level is normal or how it should be. As it was in my case, my vitamin D was low. So, so taking our supplements can be important for me in that aspect.
Mhm. Okay, so yeah, so that brings us to the end of our discussion here on Kaieteur Radio. So thank you so much. I can see that you're in your home office there, Dr. Samla, and I'm
Yes.
on my mini vacation. So thank you guys so much for joining us, and just hope that you stay safe and stay keep protecting yourself until we see you again. Bye.
Bye.